Investigations of seizures focus on determining their etiology and distinguishing them from seizure mimics. For metabolic screening, it is essential to check blood glucose levels with H-sticks and plasma tests to identify hypoglycemia. Additionally, renal and hepatic function can be assessed through our LFT, NH3, and UNE tests, including magnesium and calcium levels, to detect any electrolyte disturbances or impairments. Infection workup involves conducting blood tests such as CBC and D-C, along with blood cultures to rule out sepsis, and performing a lumbar puncture (LP) for cerebrospinal fluid (CSF) analysis to check for central nervous system infections. Toxicology screening, as well as urine toxicology to identify other potential toxins. Imaging studies play a crucial role, with CT brain scans being especially useful in acute settings to exclude acute stroke or structural lesions. MRI brain scans are indicated for cases involving adult-onset seizures, recurrent, unprovoked seizures, focal seizures accompanied by neurological signs, or known epileptics who have not responded to first-line medication. An electroencephalogram (NE) is indicated primarily to support the diagnosis of epilepsy, determine the epileptic focus, seizure type, or epilepsy syndrome, and should ideally be performed within 24 hours of the seizure. It is important to look for interictal epileptiform discharges, which can be present in about 50% of cases. Lastly, for cases suspected to be seizure mimics, a cardiac workup that includes ECG and 24-hour monitoring can help rule out cardiac causes of syncope. In instances of suspected pseudo-seizures, measuring serum prolactin levels is useful, as true tonic-clonic seizures typically result in increased levels 2 to 3-fold above the upper limit.